So today we're talking about transmasculine options for birth control because, surprise, testosterone is not birth control. Now, being on testosterone therapy can make it somewhat more difficult to get pregnant, but it does not make it impossible. It makes it kind of an inhospitable environment, so to speak, but it does not make it impossible. Even if it stopped your cycle from happening, you can still get pregnant. Don't be that guy if you don't want to be. That is, I mean, if you do want to be, then currently the advice is get off of testosterone and get pregnant and go forth and conquer with the baby. But for those not looking for a baby, what can you do about it? What birth control options are out there for transmasculine folks? So good news. Pretty much all of the ones that were available to you before you got on testosterone are still available to you even once you're on testosterone. And this is because the amount of estrogen and or progestins that are in birth control measures are insignificant compared to the amount of testosterone you're taking. And so you're not going to see testosterone be like, oh no, not birth control, and kind of keel over. It's not going to do that. Like, testosterone's still going to be going strong, doing its crap, and it's going to be like, oh, birth control, cool, whatever, and keep moving. But as far as like birth control pills, you can take the ones with estrogen in them, and or the combo pills where they have like estrogen and a progestin in them. And then there are also pills that have just a progestin in them. One of my favorites is norethindrone. I go to it a lot of times because, you know, I'll have someone who's transmasculine that, you know, no matter how much I tell them it doesn't matter that there's estrogen in certain birth control pills, they're still like, no. They still don't want any extra estrogen going on in there. And so we just stick with one with progestin only, and that's perfectly fine. It works fine. And then let's see what's another popular. So Depo-Provera, you know, the shot that you can get once every 3 months. You know, some folks like to get that. Perfectly fine to get if you're a transmasculine person on testosterone. The one thing I will say about that is if you've never had Depo-Provera as a shot before, you know, sometimes I'll do a trial on norethindrone pills first to make sure that they don't have any side effects or anything from it, because, you know, a 90-day shot is a 90-day shot. Once you get it, it's in you for 90 days, and if it's causing side effects that you don't want, that kind of sucks because you just got to wait it out. And the side effects aren't bad. It's usually just mood swings or, you know, maybe a little bit of weight gain or something like that, but still, you know, if somebody's kind of concerned about it, then I'll start them off on norethindrone pills because those are an oral form of basically the same progestin that's in Depo-Provera shots. And so it gives you a way that if it causes a side effect you don't like, you can just stop taking the pills and they're gone out of your system the next day. You're good to go. Not like a shot that's going to last 90 days. So anyway, so pills are good, whether estrogen or progestin containing. Depo-Provera shots are perfectly fine. IUDs, the intrauterine devices, that, you know, those have to be placed usually by an OBGYN, but some primary care providers are trained to put those in. Sometimes they have medication that is eluted or released by the IUD, and then there's also the copper IUD that's just made out of copper and gets implanted up in there. Let's see, there's also implants such as the Implanon implant, where they take the little thingy and they put it usually on the chicken wing part of the back of the arm. And let's see, what else? That's, well, I mean, other than like a hysterectomy where they take out the uterus. That's the ultimate form. Or, you know, you can have both your fallopian tubes removed. That's a bilateral salpingectomy. Fun word, salpingectomy. I can't even, saying it fast is the salpingectomy. Anyways, so you can have your fallopian tubes removed. You could have them, you know, so to speak, tied, although there have been instances where that doesn't quite work. Anywho, so there are plenty of options out there, and pretty much pretty much any option that you would have been able to get before you went on testosterone is still open to you now that you're on testosterone. So don't sweat it too much. Just make the choice that's the best for you, that you can be the most consistent with. Because choosing to be on pills, not a great choice if you're someone who constantly forgets to take pills. Not going to be a good look whenever you forget them for 3 or 4 days in a row and then later pop up positive. No thanks. Again, don't be that guy. So anyways, hope this helped clear up a few things for folks. Your options are numerous. Don't be afraid of them. They are not going to hurt your transition in any way, shape, or form. Just talk to your healthcare provider about getting on some, because if you are having any kind of intercourse with a sperm-producing partner, stuff can still happen, okay?